Hello everybody, this is Dr. Eduardo Beltran. Welcome to this module, to this video. Today we will be talking about mast cell activation syndrome, also known as MCAS. It is a condition that is very common, but it's not very well known amongst physicians. So today we will be addressing the basics of mast cell activation syndrome, things that we should be aware of, and how to be able to recognize the pathophysiology behind it. And also, we'll talk about a little bit about treatment. But like I said, it is a condition that is not very well known amongst physicians and healthcare providers. I think it's important for us to be able to be familiar a little bit more with it. And because this is something that will show up in your consultation, and it is something that is important for us to be aware of. All right. So those who do not know me, my name is Dr. Eduardo Beltran. I'm an internist dermatologist. I'm the creator of the LGS protocol. I'm also a research scientist. I work within the field of vitamin D and also metabolic therapy. And I've been doing this for about a good 15 years. So let's talk about a little bit about the basics of mast cell activation syndrome. So we know mast cell activation syndrome is a collection actually of different symptoms that are caused by the activation of certain specific immune cells, right? And here we're going to be talking about mast cells. These are the cells that are best well known, all right? So we know that these cells, they contain what we call granules, right? They're packed inside of them. And these are the inflammatory mediators that help in the release of a substance known as histamine, okay? Now, while mast cells play an important role, they don't act by themselves. They actually work in conjunction with other different cells here, okay? And the cells that usually are involved in all of this process are known as the mast cell quartet, okay? Here we can mention the eosinophils, the basophils, and CD40 cells as well, that all contribute to the whole pathophysiology of mast cell activation syndrome, okay? Now, one of the questions that we have to ask ourselves is, why do we have inflammation? Why does this happen? So inflammation it's very important. It's essential, you know. It's essential for survival. It triggers the immune response and aids also the process of repair, right? And similarly, cells, you know, when they degranulate to initially to start necessarily an immune action, that's one of the reasons why it happens. Now, however, when we have too much excessive degranulation, that can lead to chronic inflammation, and also that can cause, you know, significant health problems in the long run, you know. And MCAS occurs when this process becomes, you know, hyperactive. There's a lot of excessive stimulation, right? And that can lead to different symptoms, such as, you know, severe allergic reactions, anaphylaxis in some instances, respiratory issues, skin issues, joint inflammation, disruption of various body systems, and this is due to the constant chronic inflammation that's ongoing, right? Now, historically, mast cell disorders were thought to be limited, okay, as a rare condition known to be called as mastocytosis, okay. Now, the current literature and research, however, has shown that many people experience a spectrum of mast cell-related issues, and they usually are under the umbrella of mast cell activation syndrome. And these issues manifest differently from one individual to another, okay? And sometimes they're accompanied by a disorder known as POTS, which means postural orthostatic tachycardia syndrome, associated with other symptoms as well, okay, or many other inflammatory conditions as well. So usually when we get all of our autoimmune conditions, autoimmune diseases, they don't just merely just pop up as one condition, one diagnosis. They usually come in bundles, okay? Now, for us as physicians, it's very important for us to be able to identify what are the triggers that can drive mast cell activation syndrome, okay? And usually, to be able to be effective, you know, in diagnosing and detecting what are these drivers for mast cell activation syndrome, it's critical to be able to address the underlying cause, which might be chronic infections, you might have gut health issues, you might have exposure to toxins, you might have endocrine imbalances, and also you might have just simply a genetic predisposition, which is something that's very common. Now, let's say, for instance, if you have a chronic infection, you might have an infection such as a viral infection, such as Epstein-Barr virus, right, or Lyme's disease, which is very common. Or even might be even long COVID. I've seen patients who had long COVID that exacerbate their mast cell activity. If you have gut issues, well, guess what? You might have an imbalance in your microbiome, or causing, gastrointestinal immune system. Don't forget, 80 to 85% of our immune system is found in the microbiota. In our gut barrier at the level of our gut, right? So that's very, very important. 85% of our immune system is found in our gastrointestinal tract. That's something that you have to have in mind, right? So having gut dysbiosis can definitely be a reason why some individuals might be having an activation of the mast cell activation syndrome over there, right? And don't forget, where do we produce this famous enzyme known as DAO, D-amino oxidase, which is very important for the degradation of histamine? Well, we produce it at the level of the gut. So if we have inflammation in the microbiome, you're eventually going to be compromising your DAO as well. And some of us might be born with certain genetic predispositions that can make us more favorable towards this chronic inflammation, secondary to gut dysbiosis. And we might be exposed also to certain chemicals, right? Toxins, heavy metals that can worsen our symptoms, right? And of course, yes, a lot of us might have also what we call, endocrine imbalances, which need to be corrected. Sometimes you might be exposed to BPA, right? That comes from plastic. I mean, we find these things in our water. Okay, you'd be surprised to see all these things that we can actually find in water, even hormones. So there's a lot of people out there in the world, a lot of women that are using, birth control pills, and when they go to the bathroom, they urinate. They're urinating what? Hormones. And this goes into the drainage system. And a lot of the water that gets in there, we clean it and we have to recycle it to reutilize the water that's actually being used. So it is very easy to find and detect these things in our common tap water. Okay? Well, while conventional treatments in regards to treatment for mast cell activation syndrome is very basic in regards to, okay, you're having an anaphylactic shock, I'm going to give you epinephrine. Or if you're having, let's say, a specific allergy, I'm going to give you a corticosteroid or an antihistamine drug, or, some medications that can modulate a little bit, bring down the symptoms to a certain point, helps. But this is not treating the root cause of the problem, okay? So we have to have a comprehensive approach in order to be able to identify and manage, the underlying triggers, whether it's an infection, if it's toxins or gut imbalances. And it needs to be a tailored approach for mast cell activation syndrome management, okay? So when I first evaluate a patient that has a suspicion of mast cell activation syndrome, my process usually typically includes going through three different things. First, baseline testing. I'm going to be looking at immunoglobulin levels. I'm going to be looking at inflammatory markers, the basic labs, right? Second, I'm going to be looking at targeted testing. I'm going to be looking for potential allergies. I'm going to be looking for gut issues, gut microbiome. I'm going to be looking for chronic infections. And third, this is stepwise treatment. This is addressing most of the likely triggers to begin with, and then digging a little bit deeper if it's necessary, okay? And the goal is to reduce the body sensitivity and minimize the frequency of this activation, of this chronic activation that's happening, right? So it's building your effective, immune system to be able to control everything, right? Now, in order for us to be able to get our patient under control and make sure that their symptoms are under control, we have to be able to work with different professionals as well sometimes. It's not just the doctor. You need to work with your nutritionist, you need to work with your allergist, you need to be working with many other professionals sometimes that the patient already has encountered with, right? And sometimes you need to have this conversation and educate sometimes the other professional because maybe perhaps they're not fully aware of all the gut dysbiosis, how that can contribute to the activation of those mast cells, right? So we need to get in contact with these other professionals and work as a team and put everybody on par so everybody knows what's actually happening, right? Now, my final thoughts are this: is that mast cell activation syndrome, it's a very complex condition, right? And it requires patience, persistence to be able to manage these patients, okay? And by identifying and addressing the root causes of these patients, it's possible to significantly improve the quality of life. Not necessarily find a cure, but to improve the quality of life, right? And thanks to this approach, I usually see improvements in the quality of life of these patients, which definitely has a very big impact in reducing stress and improving the way how they can actually navigate life, through work, social, you name it, all different forms of spheres where they interact with other human beings and bring a little bit of more normalcy, to their lives, right? All right. Well, to sum this up, these are just basic notions that we need to be aware of what is mast cell activation syndrome. Hope you guys like this video. See you next time. Bye bye.